Well, hey guys, welcome back. So, as promised, today I'm going to share my experience and review for you all the PCA Skin Discoloration Kit. As in my review of the PCA Skin Pigment Bar, again, I am not sponsored by PCA. I'm not an affiliate of them. These are merely my own thoughts and opinions as a dermatologist and experience using the products myself as a consumer, sharing what I think about them and what I think they are helpful for. In today's video, I will just kind of talk about who I think is potentially best served by some of these products and who should just skip them, like in my last video. I will also go over what exactly in this kit I think is worth it and what I think you can avoid and what is not necessarily bad but with a decent drugstore alternative. So we'll go through them. I will discuss the ingredients as I always do. So quite a bit to cover in today's video. I imagine it will be lengthy. All right, first up, what exactly are these products useful for? If you are somebody who has acne that heals with a dark mark, some of these products will be useful to you. If you're somebody who suffers from what's called post-inflammatory hyperpigmentation, I think that you will find a lot of these products can be helpful. Many of you out there also have hyperpigmentation on extrafacial sites or on facial sites not really typically associated with acne, like around the lips. And I think you too will find that these products are helpful. If you are somebody who gets bug bites occasionally and they heal with this dark mark, some of these things will be helpful to you. If you have melasma, however, I will say this, don't expect a miracle from these products. Melasma, as I said in my melasma video, it's a very, very difficult disease to treat. And, you know, these things may be slightly helpful. You may see a slight improvement with some of these, but don't imagine that your melasma is going to melt away, all right? So just know that if you're pursuing this. It's really, the products in here are really mostly helpful for hyperpigmentation that is in the top layers of the skin and not stuff that's deeper. And sometimes in melasma, that can be the case. And nothing in here is really gonna get rid of that directly. Some of the products in this or alternatives that I will suggest are okay in pregnancy, but many of the products are not. People who should avoid this for sure, these kinds of things, are people with very sensitive skin. People with rosacea, you know, I can't recommend you go embarking on this path. More often than not, however, people with rosacea tend to be plagued by post-inflammatory redness rather than hyperpigmentation. So I don't imagine you'll be seeking this out anyways. But anyways, all right, what exactly is worth it in this kit? I would say the number one thing, first of all, this kit costs 55 bucks for basically 7 to 10 days worth of product use. I would say out of this kit, the one thing that is probably my favorite product and I'm most impressed with, and I do think is really good, is the Pigment Gel. Everything else is not necessary, okay? So let's go through the other things. Definitely skip the C and E strength. That is a skip. If you are embarking on a journey of correcting hyperpigmentation, sun protection and sunscreen militants is imperative. Okay, I will say that again. If you are embarking on a pigmentary journey, sunscreen use and sun protective behaviors are imperative. You have to dial that in. It is essential, okay? So that being said, the sunscreen in this kit is worthless and I do not recommend it for reasons I will get into, all right? So definitely skip the C and E Strength Max, which I will elaborate on why, as well as the Perfecting Protection Broad Spectrum SPF 30. Now, these two guys here, the Intensive Brightening Treatment 0.5% retinol is not a bad product, albeit expensive and with a drugstore alternative. And the ReBalance cream is likewise not a bad product, actually pretty good, but very expensive and with reasonable, affordable alternative. All right, but first up, let's just go over the all-star, and that is the Pigment Gel. I am a huge fan of this product. It is a 2% hydroquinone gel. Hydroquinone is a standard ingredient in treating hyperpigmentation, targeting hyperpigmentation, and dark spots. It is safe, but with potential side effects and risks associated with it. I have a whole video on hydroquinone, by the way, so I suggest that you check that out to kind of address some of your potential questions about hydroquinone. But you know, one of the things that is really challenging with over-the-counter hydroquinones is that a lot of them have fragrance in them, which can be very irritating. As I said in a recent Walmart drugstore video, I am a huge fan of this skin pigment gel because it actually is fragrance-free. All right, so it has hydroquinone in it at 2%, which is what you would find over the counter. 2% hydroquinone is not safe in pregnancy, so this is not one that you will want to use during pregnancy. And 2% hydroquinone can also be very, very irritating to some people, but I find in this gel form, they formulated it in a manner where I think this is one of the easier to tolerate hydroquinone formulations I have ever trialed out. I've really been happy with it. The other thing that I like about this product is that because it is in a gel vehicle, here I'll just show you, it really allows focused, precise application to direct targeted areas. Hydroquinone should not be applied diffusely to like an entire broad area. It really should only be applied to areas of hyperpigmentation, okay, areas that you're targeting to treat, because there is actually a risk of pigmentary alteration in the unaffected skin when using a hydroquinone containing product. So this gel formula, I'll just show you here, is really, really logical as far as something to apply. It's a little difficult to get out, which is kind of nice. You can't overdo it, okay? I mean, can you see that? Let's see, focus. Really easy to target, to apply this in a very targeted manner. For example, to a pimple is a great use of a product like this. Applying this to a pimple, like if you get a breakout and you have like one of those big chin pimples and you know it's going to heal with hyperpigmentation, starting the 2% hydroquinone at the time of the breakout can actually prophylactically, prevent, it can be prophylaxis against that hyperpigmentation. It can help. And you do not need to, nor should you use it indefinitely. You can only, if it's for a pimple, you can use it for the duration of the pimple being present, and then you don't need to continue using it. People will ask me, well, how long is it safe to continue using hydroquinone without a break? No more than 5 months, 4 to 5 months at the most. You do need a break from it for sure, and always best to be under the care of a supervising healthcare provider who can monitor side effects. Most common side effect with hydroquinone, as I said in the video, is irritation. All right, but in addition to having the hydroquinone in there, this product also has some other phenomenal players as far as active ingredients that target the pathways of hyperpigmentation. I talked a lot about some of these ingredients in the review video about the PCA Skin Pigment Bar, but this has kojic acid, which I'll remind you is a chelator of copper and therefore can inhibit the enzyme tyrosinase that drives pigment production. It also has azelaic acid in it, which is helpful for calming down some of that inflammation from potential irritation. It's helpful in also inhibiting some of the active sites of the enzyme of tyrosinase, so it works a little bit differently to inhibit tyrosinase than kojic acid, a very logical ingredient. Okay, so this has some other actives in the inactive list that make it a good product. Furthermore, in addition to the kojic acid and the azelaic acid, this product also has milk thistle or silymarin. And milk thistle is a very, very, very antioxidant-rich polyphenol. There are some double-blind studies of milk thistle applied topically to people with melasma showing improvement. There are a lot of lab-based studies showing good endpoints as far as protecting the skin against some of the damaging effects of UV radiation, albeit in small lab models. But importantly, silymarin does not appear to be irritating or sensitizing. So unlike a lot of other other plant-derived antioxidant ingredients. It really offers a lot of potential for improvement without subsequent irritation. So I like that the pigment gel has that in it. So like I said, this is a 2% hydroquinone containing gel product, but PCA also makes a hydroquinone-free product identical to this otherwise, okay? So all of those ingredients, all of those smart ingredients sans the hydroquinone. So fine for people who are pregnant and or nursing, just make sure you clarify that with your treating healthcare provider. And, you know, if you live in a country where hydroquinone is banned, that is an option for you. And if you have been using hydroquinone and need to stop because A, it's irritating, or B, you've been using it too long, the hydroquinone-free pigment gel is something that can be continued. And arguably, I would say even the hydroquinone-free pigment gel is even better than the hydroquinone product because it just covers more bases. You can use it more long-term, less likely to be irritating, but missing that key, well-studied active ingredient, hydroquinone. Hydroquinone is one of those where it's a little bit of a dance with the devil. Really helpful, you know, one of the most helpful ingredients, but with a lot of potentials for side effects, problems, and people you know, ends up being a bust sometimes for a lot of people. So the hydroquinone-free gel, also wonderful. And, you know, I mentioned that it's really helpful for the way that you can target and allow for precise application through the gel vehicle. For those of you out there who have pigmentary problems around the lips, you asked me a fair amount about, you can actually just paint a little, use a lip lining brush and just dot a little bit of this on and line it very precisely around your lips so that you're not getting it to areas outside of that area. Really, really like that. It's a lot harder to do that with some of the cream-based vehicles that have more spread to them. Because this is a gel vehicle, it does contain alcohol in it. I get questions about alcohol and alcohol denaturing all the time. I don't know why it is demonized to death. Yes, it can be drying. Gel vehicles are intended to be a little bit drying. And so, you know, you may experience dryness and irritation as a result of that. But alcohol denaturing, these are not like cancer-causing demon ingredients. So I strongly recommend the PCA pigment gel, either the hydroquinone version or even more so the hydroquinone free version. It clocks in at $57 for an ounce, okay? So if, you know, the discoloration kit was $55, I would just go ahead personally, you know, I would just buy the pigment gel for 57 bucks and be done with it, all right? So I do recommend that one. As far as stuff to skip in here, I mentioned the C&E Strength cream. This does not offer anything but irritation potential, all right? The C&E Strength Max cream has ascorbic acid in it, which is vitamin C, okay? And you guys know I don't use vitamin C serums because for the most part, they're just a mixed bag. A lot of them are unstable and can cause a lot of irritation. And the vitamin C in this is just ascorbic acid, and it doesn't appear to even be the stabilized form of ascorbic acid. So I'm even less confident in the vitamin C in this. It also has vitamin E in it, which theoretically can also help to function as an antioxidant and help in protecting the skin against UV damage and UV associated consequences on hyperpigmentation. But I'm just, you know, to me, that cream is not a good one because not only am I not super confident in those as active ingredients, and in my experience, more often than not, when added particularly to hydroquinone in the setting of trying to target hyperpigmentation, they really add insult to injury. They just add more irritation and inflammation. I'm not alone in thinking this. Other dermatologists, those whose focus is on hyperpigmentation, also agree. I mean, these over-the-counter vitamin C serums and creams can really be a mixed bag, and in my opinion, not worth it. Furthermore, the C&E Max Strength cream also has orange oil in it, which is an essential oil. You put it on this, it smells like a citronella candle. It's nothing more than fragrance, going to be very irritating. Just skip it. It also clocks in at $99 for I think an ounce. Yeah, not worth it. Not worth it whatsoever. The other one to skip, but not skip the step, is the Perfecting Protection Broad Spectrum SPF 30 sunscreen. I was not impressed with this sunscreen at all. It has citrus essential oils in it, so not a good choice for a sunscreen for people in general to include that in there. It can be very irritating. And you know, citrus oils always have the potential to have furocoumarins in them, although, you know, theoretically that has been extracted out. Furocoumarins are something that when applied to the skin and then subsequently exposed to UV light from the sun, even the sun that comes in through a window, can cause something called a phytophotodermatitis, which can actually be subtle but contribute to ongoing and persistent hyperpigmentation. So not a logical ingredient whatsoever. But like I said, you got to have a sunscreen on board. Check out some of my other sunscreen videos. I have thousands of, not thousands, but I have a lot of sunscreen videos reviewing different sunscreens. You know, there are many good ones out there. I happen to be using and always love the Elta MD UV Clear sunscreen. This is a great one for people, particularly people with acne that heals with hyperpigmentation. No fragrance, and not only is it a wonderful broad spectrum sunscreen, it also has niacinamide in it, which I talked about in the pigment bar video. But niacinamide not only can be anti-inflammatory, soothing, so kind of combats some of that irritation that you're going to be getting from using, if you're using a hydroquinone. But niacinamide can also impart a brightening effect through inhibition of some of the biology of pigment production. So I happen to think the Elta MD UV Clear is a much better choice for your dollar as far as a sunscreen to pair with these products. All right, but the other two guys in here are not bad. The Intensive Brightening Treatment 0.5% Pure Retinol. All right, I actually do not hate this product and think it can be useful, all right? Retinols are tretinoin, retinoids, and retinols. They are wonderful adjuvants in treating hyperpigmentation because they can actually inhibit some of the signaling pathways that tell the skin, the melanocyte, the skin that makes pigment. They can actually inhibit some of those signals to make pigment and help with hyperpigmentation. Furthermore, both retinoids and retinols can be helpful in restoring the skin barrier, which is really helpful if you are trying to cope with hyperpigmentation. A lot of these ingredients are irritating and problematic. So their brightening treatment is a 0.5% retinol. Now, go back to some of my tretinoin videos if you're confused between the difference, what the difference is between a retinoid and a retinol. But retinoids like tretinoin and adapalene or differin, those are vitamin A derivatives in their active state that are biologically active, and when applied to the skin can do things like help the skin cells behave properly, can help with acne control, and can also help in targeting hyperpigmentation. However, they are incredibly irritating, and irritation in the skin is the enemy of hyperpigmentation. So a lot of people propose using a retinol, which is a vitamin A derivative that is not in the active state. It requires your skin cells to perform an additional step on the molecule to get it to its active state. So the PCA Intensive Brightening Treatment is one such ingredient. So they're a little bit loosey-goosey as far as their biological activity, but they are far less irritating and have been shown to be somewhat helpful. Their 0.5% retinol night cream has, So in other words, the 0.5% retinol cream could potentially be helpful, particularly if you're somebody who just hasn't tolerated tretinoin. It's too irritating. You haven't tolerated over-the-counter adapalene. It's too irritating. And in addition to having the retinol in there, they also have included niacinamide, which again can be helpful for calming down the skin, acting to help restore the skin barrier, and imparting a brightening effect. And then they also have an ingredient in there that I've never talked about on here before, but it's called hexyl rescorsenol. This is a potent tyrosinase inhibitor, okay? So a very potent inhibitor of the enzyme that drives pigment. And it does so by increasing not only the enzyme activity, but also the actual expression of the enzyme. So, again, targeting a different mechanism of knocking down that enzyme that drives pigment. So it is a really logical ingredient. It's been studied in a study of Chinese women with hyperpigmentation. Applying this ingredient for 12 weeks versus placebo showed, some clinical improvement in their hyperpigmentation over placebo. It's also been studied in Caucasian skin types. I haven't seen any data in African skin types, however. So do know that it can be helpful as well. So they've got the retinol in there for whatever it's worth, and then 2 other logical ingredients. Clocks in at a steep $109, however, which is pretty steep. An alternative that I am rather fond of is, if you don't tolerate over-the-counter adapalene 0.1% as an active retinoid, if that's too irritating for you, try Neutrogena's Ageless Intensive's Anti-Wrinkle Deep Wrinkle Night Moisturizer. I love this product. If anything, it is a phenomenal moisturizer and will definitely help to restore the skin barrier. I don't know, they encapsulate their retinol in such a manner that it's really, really exquisite and easy to tolerate this. And definitely does, kind of hydrate the skin, plump up the skin. It works as a really wonderful moisturizer. In addition to the retinol, the Neutrogena one, while it doesn't have the hexylriscorsenol or niacinamide, it has licorice root extract, which licorice root has things like glaberadins, they're called, and licurotins, that likewise target the biology of pigment production, so can impart a brightening effect. I think this is a really great choice for people out there with hyperpigmentation to consider. Clocks in at $22 for this 1 ounce, so substantially less expensive than the $109 for the PCA one. And then lastly in the lineup, the PCA Skin ReBalance. I did not hate this, but don't find that it offers anything. Okay, this is basically a moisturizer, which is needed with these products. A nighttime moisturizer. You need a daytime moisturizing sunscreen. In my case, I've been using EltaMD's UV Clear. And at nighttime, when you're using these products, you need to finish it off or use it concomitantly with a no-nonsense moisturizer. And theirs is no-nonsense. I really like it a lot. It's the ReBalance. It has, what does it have in it? It has niacinamide in it, and it's fragrance-free. Very nice. It clocks in, however, at $44. All right, a niacinamide-containing fragrance-free moisturizer is not a hard thing to find in the drugstore, so you don't need to spend $44. CeraVe makes a variety of niacinamide-containing fragrance-free moisturizing creams. And not in the drugstore, but on good old iHerb. I happen to think the CosRX Ultimate Nourishing Rice Overnight Spa Mask is actually superior as far as a niacinamide-containing moisturizer to the PCA Skin ReBalance. And I can't remember what I pay for this. I love it. I get it on iHerb. I think it's like $15, I want to say, for 2 ounces. So, for whatever it's worth, I happen to think this one is better, and I really enjoy it. Not only does this have niacinamide in it, but it also has fermented rice beta-glucans in it, which are very, very moisturizing. This is a great moisturizer. I found the PCA Skin ReBalance, it's a decent moisturizer, but if you're somebody who has dry skin, particularly if you have a lot of irritation from using these products, I don't think that this is going to be enough as far as a moisturizer. I think you'd be better served with Cos, or definitely with CeraVe. You would be well served. Or even Neutrogena's oil-free moisturizer would be a good option over that. Just something more affordable and doable, okay? Like I don't think you need to plunk down $44 for a fragrance-free moisturizer. Likewise, I don't think the sunscreen is worth the cost, particularly with the addition of the fragrance oils, the essential oils in there. Don't think that that's worth it. So yeah, and then definitely skip the C&E Strength Max. That is really, that just offers a potential for irritation. Doesn't really get you anything, and is very expensive. Now, I'm not sure I mentioned as I was going through each of the products, but as far as things that are absolutely contraindicated, for those of you out there who may be pregnant, are the hydroquinone containing pigment gel, as well as the intensive brightening treatment with 0.5% retinol. Those would not be indicated during pregnancy, but everything else in here is fine, or the hydroquinone-free pigment gel. Again, always discuss with your treating healthcare provider, but those products don't have any ingredients in them that are contraindicated during pregnancy or lactation. But yet again, some good products from PCA Skincare. I hope you all enjoyed today's review of these. If you liked it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. Talk to you guys tomorrow. Bye.